Dear students, we are in the third part of the topic sensory integration therapy. So, in children with sensory under responsivity, the brain has too high of a threshold. That means that the threshold level is higher, meaning that a small stimuli or a normal stimuli will not touch the threshold, so that in order to get a good response, the threshold has to be reached. But here, a high threshold, meaning that a high stimuli can only touch the threshold. So for a normal response, the child requires high stimulation. So that is not good in a good normal condition. So these children, what they will show, touch difficulty noticing touch. Somebody touches them, they will not even notice, because that touch, normal touch sensation, do not reach their threshold level. The brain does not perceive it. So dress inappropriately for weather. They are not aware of their dress. Sometimes the shirt comes off for they're like well dressed in the morning. In the afternoon, you will see that the shirt. They were not aware of their dresses, the dress or the shoe they wear, because that means that the tactile system is not giving them proper information. Most of the time, they are not at all. So that means that they require other senses to for example, if the tactile sense is under responsive, that means they will require vestibular. They will require, sorry, a visual sense to cover it. So that's why they would require a mirror or someone else to tell them to properly dress well, like that. So vestibular sense, if there is unresponsive, means small movement and all, they never get dizzy. They will enjoy the giant wheel or a roller coaster. If somebody, being the kid, if you just throw the kid, the child will laugh and smile. They don't get, they are not afraid by motion. They will enjoy the movement. Normally, adventurous thing, they will enjoy adventurous fall or movement, such kind of movement. Um, these kind of kids are often called as thrill seeker. They love thrill, so they will be jumping and they'll falling, they'll doing somersaults, those kind of things. So the unresponsive, the hyper-responsive will never do that. The unresponsive will always try to move, and not only normally move, try to move in an adventurous way. Visual unresponsive often misses what they don't have any sometimes normally what people will visually see, these people will not even recognize. Somebody passes through in front of them, they will not recognize that person. That's only because they are not, they don't take all the stimulation. They will take only the largest stimulation. So bigger, whatever is catchy for the eye, they will only see that visual stimuli containing the sensory under responsivity in proprioceptive, that is joint sense and kinesthetic sense. Poor body awareness, they will not be aware of their position, how they sit, how they put their leg. So in a bad position, they will not hold their limbs in a good position according to the situation they are. They will be unaware of how they are sitting, how they are holding their hands, and those kind of thing. And usually children will have floppy and poor posture, bend down, floppy, sitting in a very bad posture. Auditory, they listen to, they if they have to enjoy, they music, or they need loud voice music, and they'll need loud TV and task so these kind of, those who are unresponsive auditory, they talks to self during it. They like to talk a lot during doing a job. If you ask them to do something, they cannot keep quiet. So these kind of under responsive auditory problem, children will keep on be talking. They always want to talk. They always need to talk because they like to hear their own voice. And when they talk very loudly. So these kids will have that kind of. So they'll be always be singing loud songs and running here and there and always talking loudly. And oral, that is for under responsiveness of the mouth, that is the palate and the tongue. Maybe they will eat anything, they don't even like, bother. And they will also explore a lot of things. They will try to put something in or put a coin in the mouth, put a knife inside they want to experience. They will not getting enough stimuli in the mouth, they will try to put everything hard. And those these kind of kids, they love eating very, like they like to eat chips, what you call as crispy things. They don't like soft food and all. They will like, something different, like which is, it gives a lot of stimulate to the mouth, and they will always love food which are very, what you call as sour, or with a lot of chili, or those kind of things. They love hard sensation, like something like sour and something what do you call it, pungy, those kind of things, food they love. Sensory, the other one is sensory seeking bar craving. This is another group of children. They always need some sensation. Example of these kind of children are, if you go to a class, and I usually understand these kind of kids, because when they cannot sit, if they sit, they will move their they'll be jerky, moving their knees. They will be, when if they get a pen, they will be rotating the pen. They will be, just clicking the pen. They will be sometimes moving their hand. They'll be knocking onto the table, creating some sound. Those kind of, they always need some sensation, and the sensation meaning from themselves. They like to, tactile. They these people, they love, if somebody asks them, beats them, they love it actually. So they need some kind of sensation. They like to be touched, and they like to be, some kind of tactile sensation. They love textures such as hard texture. They love to hold rocks. They like always like to hold such kind of objects with a lot of different texture. They enjoy that texture. In vestibular sense, they love jumping. They are always jumping, trying to fall. Sometimes even they like to fall down. They bang their head on the walls. They try to bite themselves. Even so, some children, when you see, they're always biting their nails. These are sensory seeking behaviors: biting nail, banging their head, biting their own hand. Those kind of sensations are called as sensory seeking or craving. They crave for sensation, all kinds of sensation. And in assessment, you will understand that which sensation they are craving more according to their abnormal behavior. So the sensory discrimination disorder, as we already have discussed, that is the sensory processing disorder subtypes. In the sensory under which comes the sensory discrimination disorder, we have the visual sensory discrimination disorder, auditory, that is ear, tactile, touch, vestibular movement, proprioception muscle, taste and smell, that is mouth and nose. Sensory discrimination disorders example are proprioception, constant slamming of, they have difficulty in discriminating the proprioception. They will constantly slamming the doors, pushing too hard sometimes to increase awareness. In tactile, the discrimination, children with discrimination disorder need to use eye. They cannot just judge what is happening, or to, if what is touching them. They need to see what is touching them. Sometimes, for example, some people, if to take something from inside their bag, or pouch or something. Usually, normally when we are using, they don't need to see what is inside. They just put their hand and they can take it. But these kids, they need tactile. The thing is not enough. They need to look into the bag and try to get it out. Taste, smell, difficulty in these children, they don't know how to discriminate. They don't know how to discriminate between, for example, if I tell you taste and smell, like they don't know to discriminate between a normal vegetarian curry and a sambar. And they will not understand whether it is chicken, or the meat is chicken, or it is beef, or those kind of things. So these kind of discriminatory normal ability will be lacking in this children. Vestibular sense, they frequently will fall out of chair. If they are sitting somewhere, they don't know that they are falling out of the chair. They are falling out from the position where they are sitting. They will not know that, because they don't know to discriminate between their the platform in which they are standing, or where they are sitting. So in that, we have already discussed in sensory. If it is in the sensory based motor disorder, I already told you two things only: postural disorder and dyspraxia. Dyspraxia means motor planning will be affected. In postural disorder, postural Disorder is poor co-contraction, poor or low muscle tone, abnormal equilibrium and abnormal posture, immature reflexive abilities, difficulty in bilateral integration. All this will affected. Poor co-contraction, low muscle tone, abnormal equilibrium and posture, immature reflexive abilities. So the reflexive abilities are immature means the reflex activities are not up to the mark, and they have difficulty in bilateral integration means that what we call as bimanual activity, they will be having difficulty. These children, they will have difficulty even, for example, bimanual activity means we require activity of moving the two hands in a synchronized manner, or moving the two limbs, lower limbs, in a synchronized manner, for example cycling, or for example using two hands to play tennis, or those kind of things, playing basketball, throwing a ball with two hands. This kind of bilateral, using the usage of the two sides together in a synchronized, what we call as bimanual. So bilateral integration will be lacking in this children's. Examples of dyspraxia, I already told you, difficulty in doing skilled movement. So poor gross motor skill, such as we are talking about higher gross motor skills here. Normal gross motor skills are transitional and positional activities, such as rolling, that is prone to supine, supine to prone, supine to sitting, that is transition. That sitting is a gross motor activity, and then sit to stand is a transition. Standing is a gross motor activity. In prone lying to kneeling, prone kneeling is a transitional activity. The other, prone kneeling is a motor skill, and kneeling is a motor skill. High kneeling, half kneeling, all those are motor skills. So here we are talking about poor higher gross motor skills, such as these children will have difficulty in running. They will frequently falling, and the other jumping and all, they will jump and fall down. They don't know how to balance themselves. The children with dyspraxia, they will have poor fine motor, fine motor activities means using your the what you call as the tips of the fingers. That is, when you have studied in biomechanics, you all know that the fine pinches, like the pulp to pulp, side to pulp, those kind of using finger, like zipping, buttoning, sewing, holding a straw, or so, like those kind of activities, they will have severe difficulty, like even holding a pen also. It's kind of a fine motor activity, will be difficult for this group of children. Problems in figuring out how to do movements, like dressing, activities of daily living, like doing dressing in a toilet. All those things are learned. Actually the child, the parents teach them to do it. So these children, they will have difficulty even when they become big also. They don't know how to tie their own shoes, they don't know how to wear their own socks, they don't know how to dress well. So they cannot they will not be good dancer. They don't know how to dance because they don't know how to the normal proprioception, all those things are affected. So these kind of things will be there. Poor motor control, that is proprioception, body awareness, all those will be they'll be there. And they will have difficulty when they go through some place. Usually the normal sign of a child with the dyspraxia is that they will, when they walk through a crowd, they will go and bang on everyone, they will hit on everyone. Examples of postural disorders: low muscle tone, that means slumped in chair, lean on things. Whenever they stand, they will lean on the elbow, they will move, and when they sit in a classroom, they will be swaying and putting their body weight on another person and slumping on those kind of low muscle tone activities common in children with postural disorders. Poor balance, they will often trip and bump into objects. They will they will face difficulty in riding bikes or jumping. Poor stability, they cannot stand still, they cannot sit properly, they will sit in awkward positions. Head and eye stability will be lacking. They cannot hold their head and eye in a proper way. When they walk or when they sit, they put their head in a different way, they look in a different way, they tilt their head to look in a particular object. Those kind of things. When they are writing on the paper, they tilt their head. use of two sides, I have told you bilateral integration is not affected too much. Knots